So hello everyone and welcome to I think this is event 28. We're at the end of week 5 of Insight 2020, a festival of analysis and learning in health and care. It's been a fantastic week this week. We've heard from a local system on how they use intelligence and insight to shape decisions they make. And we've also had the local authority perspective on the hierarchy of evidence and how local stakeholder views can influence this. We also heard, so this is Mohammed and I's second time on this week. So we were on earlier talking about the Decision Support Centre's Education Development Programme, and also the NHSR conference is also going on this week. So we've had a couple of crossover events with them. And finally, we had the Health Foundation along to talk about the NHS as an anchor institute, and a really insightful session from Dr. Jake Stewart on the personal impact of long COVID and making sense of the emerging evidence base. Today, we're talking about decision quality. So this is something that Mohammed and I have been exploring over the last few months. It's something that kind of came sort of caught our eye when thinking about the purpose of the decision support unit and how we can support strategic decision making in health and care. Before we dive into the session today, just a few bits of housekeeping. Mohammed, if you wouldn't mind just flicking on to the next slide. So just please keep your microphone on mute while we're talking, but please do introduce yourselves in the chat box. If you've got any questions or technical issues, please do use the chat box as well. We're recording the session today and we'll be sharing that afterwards. And if you like to tweet, please do tweet using hashtag Insight2020 or tweet us at strategy_unit. I think that's it in terms of introductions. I'm just going to share a bit of background to today's session. So Mohammed's going to be leading most of the content today, but in starting to think about this, we also developed a bit of a guide to strategic decision making in health and care. So that's kind of your background reading for today's session. So I'm just going to post the link to that in the chat box. So do have a look at that as well if you have time. Oh, hang on, I've just sent that to the wrong person. Everyone, there we go. Trying to multitask, it's always a challenge. And I'm also going to do a bit of an interactive introduction. So if you could all go to Mentimeter. I think, Mohammed, would you mind moving on to the next slide? Whoops. Oh, that's coming up next week. Oh yeah, so before we move on to Mentimeter, I should say what's coming up next week. So next week is the final week of Insight. Plenty still going on. So on Monday, Fraser Batty and I will be interviewing Kate Cheemer from the British Heart Foundation, Anthony Nichols from the Black Country in West Birmingham, and Stephen Wyatt to talk about what do analysts bring to the task of leadership. Session not to be missed. We've also got a session on accessing the data and code that underpins the Decision Support Unit network analysis of healthcare use at the end of life. So if you were here for Justine's session a couple of weeks ago and saw the results from the end of life report, then if you want to know what the code that went into that, please do come along to that session. On Wednesday, we'll be talking about population health management. This is something that we were very focused on this time last year, and we think that is still really important, as particularly in current circumstances. And then on Thursday, we'll be hearing from Al Mully, which is a kind of follow-on to this session. So he'll be talking about a particular way of measuring decision quality, in particular linked to shared decision making. So lots to come to next week. Right, hopefully that's given you all a bit of time to code to Mentimeter. And hopefully you've seen the first question. Somebody's definitely made it in. So we've just got some introductory questions so we know who is here with us today. Mohammed, I'm just going to boot you off the screen sharing for a minute. So we just want to get a kind of picture of who we've got in the audience, who's joining us today. So if you wouldn't mind getting on to Menti, if you've got any problems, put it in the chat box and Janine should be able to help you out. So we've got a lot of analysts as per most of the festival, which is great, but also some managers and some others. If you're an other, please do let us know in the chat box who you are and how you describe your role. I'm going to hold it there for a bit longer because we've got about 40 people in the meeting. People are coming in all the time. So anyone who's just joined us, we're using Mentimeter at the moment. So please do go to www.menti.com and use the code 2260517. Okay, so actually quite a mix of people. So big analyst cohort, but also some others. Fab. I'm going to move on to the next question, which is trying to get an understanding of what sort of organisations you're from. So don't worry if you haven't filled in the other question, but please do, yeah, join us with this one. Local authority, a couple of provider trusts, some others. Oh, again, if you're an other, please do let us know what organisation you're from. I'm assuming people have already. I'm not actually looking at the chat box, but yeah, do carry on putting things in there. Okay. Right, this is so the final introductory question. What 3 words come to mind when you hear decision quality? So just to get your brains in gear, and we'll see whether or not what we're talking about today matches your perceptions of decision quality. Good, bad. I'm enjoying that. So evidence definitely coming out as the front runner. Measurable, future thinking, evidence-based, accurate information, pragmatic, data-driven, range of inputs, collaboration, informed. Somebody's put gut. Facts. Okay, that's really helpful. Good to get an overview of what you're thinking so far. And evidence definitely coming out as the strong winner there. So I'm now going to hand over to Mohammed, and he'll be leading us through today. As we said, this is something that we've just started exploring. So at the end, we'll be asking for your reflections on what you think, and feel free to disagree with what we've been saying. We're keen to have a bit of a constructive debate about this and to be challenged. So yeah, Mohammed, I'll hand over to you.
Thank you very much, Lucy. And Lucy, if things come up in the chat, when you just kind of alert me to them, please, because I'll just carry on with the presentation. I'll just share my screen again, 1 second. Okay, are my slides visible?
Yes, yeah, we've got you.
That's great. So can I just start really with a very humble position, really, just to say that nothing that I'm going to say today is trying to point out that what other people are doing is in any way wrong, or try and undermine kind of attempts to improve things, or even say that you can't do it without us. I'm not even suggesting we've got a quick kind of silver bullet, or that it's easy, and especially the aim is not to embarrass or blame anybody, and there's lots of other caveats really, but I hope you take this in this kind of spirit as intended, which is really a kind of conversation really about something which I think matters to many people. So this is a very little exercise. Some of you seen
Mohammed,
it before.
sorry, just to interrupt you. Would you mind speaking up a little bit? Your croaky voice is a bit quiet. I know that you don't want to shout too much. But...
No, that's fine. Is that any better, by the way?
A bit better. Could you do a little bit more?
Okay, yes, I will have to go to the pitch of my voice. Right, there you
are.
No, that's fine. So here is an example of a decision that might be made on a routine basis in a health and care setting. So you will be asked to do this on Menti, by the way. So here's the question. A commissioner is going to fund the development of a new day ward. They think there's going to be about 16 patients a day. How many beds should the commissioner kind of pay for to ensure there's a kind of 95% service level agreement in place? So there are the options: 12, 14, 16, 18, 20. So one thing is for sure, it's an even number answer. So would you please try and give your response on Menti, please? Are you going to take control of the screen, Lucy?
Yeah, I'll share it once we've got enough results. I'll
oh yeah, okay, that would be great.
We've got about 5 people so far.
Okay. Thank you. Yeah, so just have a go. And I'm just to reassure you, I'm not going to point out what the correct answer is. I just want to use it to illustrate really how we think about these questions and what sort of variability we get in the responses that come. So nobody will. If you don't know what the right answer is, I won't be kind of in any way trying to embarrass anybody by declaring what it is. That's not the purpose of the exercise, really.
We've got about 23 results in, so I'll share my screen now.
Yes, okay, thank you. And that's about half the people on the call, which is perfectly healthy. Thank you.
So there we go. We've got most people have gone for 18.
Yeah.
A couple at 20.
Okay.
At 16, 14.
That's great. So look, we had a single question then, and we've got variability in responses. So and this is a situation where there is actually a correct answer. So if we can go back again, please. Oh, I go back to my slides. I'll just screen share now. Thank you, Lucy. I'm just switching again, folks. Just give me a second. Okay. So we will come back to that that notion of why we get a variation, in responses. So if somebody asked us this question, what is our most important decision? I wonder what people might think, really, but I was quite struck by a response which I heard, which kind of made this point, really, that our most important decision is really how we make decisions. And I think every now and then, for me, I think that's really quite an insightful thing to be reminded about. So here are some, this is from the corporate sector. This is, I'll tell you a little bit more about the source in a minute, but here are things that people have found that can go wrong in decision-making or in the decision-making culture of corporate organizations, of the kind of private sector. So this is not NHS at all. And you'll see some terms here: hidden agenda, strong beliefs in spite of the evidence, an advocacy process. You can just infer what you want from that for now. No standard for judging the quality of a decision. So this is what it looks like in a kind of corporate sector kind of survey. I'd like you to try and engage with this through Menti and just give me a sense of what your thoughts are on the extent to which those bold words actually reflect your experience of decision-making culture in health and care. So another switch to Menti, please.
We're going to have to do this in 2 blocks, I'm afraid, because I couldn't fit them all onto one Menti. But so the first section is hidden agendas, strong beliefs in spite of the evidence, seldom have well thought out alternatives, and advocacy for a particular idea.
think once we get kind of close to 23, 24, Lucy, we can.
Okay.
Mohammed, while
Yes.
people are doing that, people are struggling to read your slides because they're coming through quite small.
Okay.
And although I can change them on my screen, I don't think it's going through. So I just wondered if when we go back to your slides, if you could just have a play and make them a bit bigger, please. Thank you.
Yeah, I'll try that. Thanks very much, Janine.
Okay, that's quite interesting for the first bunch. We'll move on to the second lot now. So there seems to be more consensus on the first lot than this lot. Any thoughts, Mohammed?
No, I think that's. I'll pick it back in the session in the slide deck. Then thank you, Lucy. If you hand
Great.
over back
No
to me.
problem.
Okay. I'll just share my screen. So, okay. So let me. So the thing I wanted to point out, Janine, this is as big as I can make my slides. Is that any better, by the way, or?
It's better for me, but I've got a nice big screen, so hoping it is better for some of the other people.
Okay.
It is a bit better, Mohammed. Peter here. It's a bit better.
Yeah, thank you. I'll
clearer.
So the thing I wanted to highlight really was that these notions about decision making are not located in a particular sector of the world, as it were. Wherever human beings are, these are the sort of factors that interact with the decision-making process, really. So I didn't want us to be particularly hard on the public sector, thinking that things are pretty rosy elsewhere. So if making decisions is our most important decision, then what's our second most important decision? Well, I think it would follow in how we act on our decisions. And the sweet spot would be that if you make the right decision and you act on it in the right way, then you know, success looms, really. But when people do study decisions, so this is quite a relatively old paper, 1999, but the lessons are still being learnt today. A systematic study of organizations, which included healthcare organizations, looking at 356 decisions. And the author of the research found that about half the decisions in those organizations actually failed. They could have failed because the decision itself was flawed, or the implementation, the action that followed, was flawed. And the two, of course, are not, the two are related. So we recognize that decision making is challenging. So that's a given, really, and it's certainly much harder in complex adaptive systems, the kind that we experience in health and care. One of the reasons decision making is hard is because our brains are wired in a particular way, really. One of the things our brains are wired for is when they're trying to kind of do something, we're optimistic about it by nature. And that's entirely appropriate, but optimism bias can lead us to a terrible, to a really interesting place. So here's a little story, if you're familiar with it, from Daniel Kahneman's book. The Scottish Parliament building was estimated to cost about 40 million. Now, I just want to remind you that this is relatively recent. This is not kind of pre-scientific methodology and stuff. This is modern day project management with all the kind of software technology, methodology, and kind of multidisciplinary team working that we have. So a high profile project started off at an estimate of 40 million. The next time they looked at it, it went up to 109 million. And then there was a cap from legislators to just short of 200 million. And by the time they looked at the final cost, they kind of insisted it can't go above 241. And when it finally finished, it was 295. So in each case, you can see they were being optimistic about what the thing would cost. And just in case you think this is, yes, but this is just, what large infrastructure projects are like. Oh, sorry, I didn't realize that the last point is it cost in the end even more than 300 million. So just in case we're thinking, this is a peculiarity of large infrastructure projects, that's what happens. Here's another kind of illustration, really. 125 physicians were asked to look at mammograms and were told about the accuracy of them. Don't get too involved in the numbers for now. They were asked to say what the likelihood was of a patient having a malignant tumor given a positive result. So 4 out of the 5 physicians said 75%, when in fact the correct answer was 7.5%. For those of you interested in this, it's a bias that emerges from excluding the outside perspective, ignoring the base rate. So I've just given you 2 illustrations of what one is the optimism bias, and the other one is kind of this neglect of the outside view. And there are lots of other biases, by the way. So just pointing out really that how human decision making is and has always been subject to these biases. We become more aware of them. But nevertheless, they're kind of hardwired into our kind of our brains, really. So what are we therefore trying to do then in thinking about decision quality? Well, what we're trying to do is we're trying to maximize the odds of success, really. And success is this notion of making the right decision and then acting upon it. And kind of a catchy phrase for this would be this think about kind of doing things right versus doing the right things. So doing the right things is trying to make the right decision, and doing things right is trying to act on them as best we can. But doing things right, of course, isn't the same thing as doing the right thing. So it's a combination of those things. And we're not saying that we can therefore kind of always get things right. What we are saying is we're trying to maximize the odds of success. We also recognize that decision making, of course, is a core leadership function. And I've already pointed out, of course, it's challenging for all sorts of reasons: uncertainty, complexity, human fallibility, subject to biases. And if we kind of look back just informally in our kind of a thought experiment with what percentage of major decisions are high quality, you might say low, medium, or high, and we could kind of discuss and debate that, and what might be interesting to survey that actually quite systematically at some point. But perhaps we would find greater agreement on this notion that few organizations have processes to ensure high decision quality. That's probably the thing that I think we would tend to agree on. And if that is the case, then it comes back to a kind of a premise of systems theory, really, that every system is perfectly designed to get the results it does. So in the absence of a reliable process to get high decision quality, we're not likely to get high decision quality as often as we'd like. So can we improve decision making? I think again, the non-controversial answer to that would be yes, of course we can, and maybe we should. But the counter to that often is yes, in principle, of course we should, but we don't have time. That is a common kind of barrier that is highlighted for any improvement activity, and I think decision making would also find that to be a common barrier. But here's an interesting insight from, I'll give you the reference for this in a minute, but this is quite remarkable, isn't it? That we never have time, we think, to do it right the first time, but then we always manage to find time to do it over. So I kind of thought, yes, that's, I can think of many things in my decision-making process, really, or that I've made in the past, where I've fallen into this pattern of behavior. So the material that the people who've coined the phrase decision quality are colleagues from the States. They're mostly attached to the University of Texas, and it builds on work that was done by economists, really. And they make the point that quite early on, that aren't most businesses and individuals already making high decisions? So this is a quote from the book. So the answer is no. The ability to make good decisions is not inborn. 15 years of behavioral decisions science research has revealed hundreds of biases that are part of human mental processes and social behaviors. Thus, although people widely believe that they are inherently good decision makers, this belief is an illusion and a dangerous one. And the biggest challenge is recognizing this illusion and understanding there is room for substantial improvement. Now, look, I'm not saying you have to agree with everything that's there, but I'm kind of just giving you a sense of where some of the material I'm sharing with you comes from, and in fact much of what I will be saying now will be drawing from the decision quality book. So the first thing to note about decision quality is the contrast between a decision and an outcome. So here's a simple illustration. A drug company backs a hunch to develop a novel cancer treatment. They find positive results in the research, they get licensed, they go on to have increased revenue over the next 10 years. It's a very successful drug from their point of view. And so does it look like a good decision? Well, what if I tell you that 20 years later, actually, we learned about serious side effects and there is now litigation for that company? So now, how do we gauge whether or not that was a good decision or not? And so one thing to note is that the quality of a decision cannot be judged by its outcome. So I think that's actually very liberating, because the future is uncertain. The notion of using the future to judge a decision is actually not a very rational one. So from a point of view, leaders in decision making and decision quality, I think it is quite liberating to know that you cannot judge a decision by its outcome, because outcomes are sometimes also, they're always uncertain, but they're almost always long term as well. And you can only judge decision making by what happened at the time. And so you have to be prepared for this notion that a good quality decision can have a bad outcome. And likewise, a poor quality decision can have a good outcome. A simple illustration of this is the amount of evidence that there is that people will use their mobile phones while driving. Thankfully, many of them don't have an accident, or an accident doesn't result, but it's not a good decision, but the outcome is good. So the point about improving decision quality is trying to improve the odds. So here are the suggestions from the decision quality authors, really. What they suggest is that decision quality is determined by 6 links of a chain. So the entire chain is what determines decision quality. I'll go through some of these in a minute, in a short while, but I just want to give you some kind of highlights, really. Because it is a chain, therefore everything interacts with everything else, and the strength of a chain is governed by its weakest link. So you know, if everything else is in place, one of the links is very weak, then the likelihood of decision quality being high is, in fact, the decision will be low quality. And the other point to note is that in all of these things, we have to be aware of decision traps and biases that I've just tried to illustrate with some of the kind of examples earlier. So I will talk through these in a moment, really. But this is a process by which we can judge the quality of a decision. So how might that look like in practice? So here is the decision chain laid out vertically. Here are the various links that I'll talk a little bit about in a moment. And what the authors suggest, and they are being pragmatic here, what they are saying is that if you scale, let's just say, let me just take this one for example, when you're making a decision, how committed are you to actually acting on that decision? So obviously a simple thing would be that if you are making a decision but you don't intend to act on it, then actually there's no point in making that decision. That's not to confuse inaction with no action. Inaction is a type of action, but the commitment to action, if you have none at all, then there's no point in thinking about the decision. So you scale that from 0 to 100, and a decision reaches 100% quality, i.e. the best possible decision we could have made under the circumstances, when we judge that the additional effort to move from left to right is not worth the cost or delay. So here's a kind of a notional decision where we're kind of 80% sure we've done what we can to understand the problem, identify what the frame is, less so with alternatives, and so on, and our commitment to action is kind of around 50%. So this blue line, this decision is now of 50% quality. It's not reached the 100%. 100% is not perfection. It's just saying that we've done what we can under the circumstances. So we'd want to move the blue line to the right-hand side of the slider, as it were. So I'm just going to take you through now each one of the kind of bits of the link, really. And as Lucy said, look, this is for us. This is an introduction. I've just read some bits. Really, I'm not a practitioner at all, but I felt they had some interesting ideas which would merit a conversation, really. So thinking about the frame, there are three things really: purpose, perspective, and scope. So what's the problem we're trying to solve? What are the opportunities we're trying to address? And how, why are we doing so? What's the motivation behind it? And how will we know if we're successful? And then the perspective, what is our view on the situation? What are the ethical concerns and the kind of perspectives of stakeholders? And the other thing about scope is really what's in and what's out. And the box on the right is just reminding us really that getting the right frame is for the decision problem is, of course, you know, what's the question we're asking and so on. But we must take care not to solve the wrong problem. And it is often the case really that we will do the wrong thing really well. So quite a few decisions actually fall into this bear trap of actually doing the wrong thing because they're solving the wrong problem, and it does take some time to make sure that we've got that agreed. Thinking about alternatives. So alternatives, it is quite interesting, this point about alternatives, that alternatives should be characterized as follows really. They need to be creative. They need to span a range of possibilities. So improbabilities wouldn't count as alternatives. The alternatives need to be materially different, and each one of them should be compelling and feasible, and also coherent. And perhaps a way to summarize that would be, imagine you put out a job advert for a very senior role, and you have, you know, several candidates apply, of which 3 are compelling and feasible, and you've got to kind of really kind of scratch your heads about whether you can, and you're almost thinking, oh, if only we could recruit all 3. That's the kind of tension you want to know that you have explored compelling alternatives, really. And it is, again, just a very useful observation, really. The value of a decision can be no greater than the value of the best available alternative. So being careful not to rule out alternatives early in the decision-making process is a very important kind of trap to avoid, really. And when we see alternatives, one of the things that pops to mind really is this notion of conflict. Well, conflict has a very healthy and a very unhealthy role. Conflict is actually very healthy during a decision-making process, particularly because it helps us to find alternatives or think about materially different courses of option of travel. But after a decision has been made, then conflict is a poison. And it is the job of leaders really to try and manage conflict at the time of decision-making process, at the time of the decision-making process itself, but then to kind of, and if you manage that well, then the likelihood of conflict afterwards is actually minimized, and that's obviously a very good thing for decision-making. But if conflict is not allowed in the developmental phases, then it settles into a kind of center of gravity kind of after the decision making has happened, which is not good. One of the ways we visualize our alternatives is through decision trees or decision analytic trees. I'm just kind of giving you a visual of that. If I get time, I'll show you one a bit later. So the other part of the chain then is, this is where I think, the decision support network and the kind of DSC and so on, it can help with all of this really, but there are some particular spots where I think they would be very valuable. Obviously, just going back, thinking about materially different options and so on would be also where we would value perspective from others. But for each of the alternatives that is being looked at, we would like relevant and reliable information. And this is where I see analytics really coming to the heart of decision making, where it helps us to articulate the possibilities and the probabilities, and it allows people the permission to be uncertain, and it makes that uncertainty unambiguous. If you go back to the Scottish Parliament building, none of those numbers had any uncertainty attached to them. And yet, looking back with hindsight, of course, there must have been huge uncertainty. And actually, even at the time, you would imagine there was huge uncertainty. So analytics should help us with articulating possibilities and probabilities and putting that information together in a relevant, coherent way for the decision that's at hand. We can also do sensitivity analysis just to see which of the parameters are kind of particularly critical in terms of making the decision. But the relevant and reliable information needs to look at possibilities, make sure it's relevant and be reliable, be from a trustworthy source, which avoids biases and decision traps. And this is what I personally see one of the key things that the decision support unit network should be offering is reliable, relevant, trustworthy information, which is bias-free. As best we can, or at least make the biases as explicit as we can. And for those who are analysts on the call, here is a quote from that I came across in the text, which kind of reminds us really that information in its broadest sense, it is a source of learning, but unless it is organized, processed, and available to the right people in a format for decision making, it is a burden and not a benefit. And I think this is one of the reasons why sometimes decision makers will go ahead and make decisions without kind of bringing in analytics and evidence and so on, because it actually it burdens them. It doesn't actually remove barriers. It actually seems to add to their problem. So that's a kind of a bear trap to avoid really when we're thinking about how we support decision making with relevant and reliable information. And the other thing about this is this process is that it asks you to make very clear, you spell out your values and your trade-offs very explicitly. So all decisions are about values, and values often are subjective. and if you have multiple values, then there are trade-offs to be required. And sometimes people can express these in monetary units and so on. But this notion of making our values and our trade-offs explicit helps to make things transparent, helps people to understand different perspectives, and helps people to arrive at a sense of what is the best option to take in an explicit way rather than in an implicit way. And the other part of the chain is this notion of sound reasoning. So obviously sound reasoning applies to all aspects of the decision quality chain, and it should reveal the choice that maximizes value. There are two particular tools that people have found relevant. There are many others, but I'm just highlighting two of them for now, that when we're thinking about the complexity of the decision so that we can make sound reasoning, is this notion of an influence diagram. And here's a quick illustration, really, the kind of just a way to visualize the interacting factors for that decision that's being made. And a tornado chart, some of you will know about this, but if I just quickly highlight here, this is a decision that's being made to try and reduce some cost, and you can see for each of the factors that's being considered, you've got an interval of uncertainty ranked in a particular way. So hence it looks like a tornado. But what this helps us to do is to recognize that, okay, there are multiple factors in this decision, but actually only 3 of them really matter, in the sense that they carry the greatest uncertainty. And if we are not confident about making our decision, we want to gather more information, then the value of information from the first 3 is much, much more fruitful to us than, say, information from the last 3. So it helps to direct us really as to which factors are crucial, where we need additional information, and where it was very worthwhile spending money to get that additional information. Because if we do get it wrong, the likelihood of the impact on the outcome is so variable that we could end up with a really poor outcome. And so just, not all the factors that influence the decision are crucial, in the sense that not all of the information contained in those factors has the same value. And part of sound reasoning is to help unsurface those things. And then perhaps last but not least, a commitment to action. So those who are responsible for implementation should be brought into the decision-making process. That's kind of stating the obvious. We expect that to help enhance the quality of our decision and the likelihood of our success. So it will do both things, really, make our decision better and make its implementation better. But it's also worth pointing out, really, that intention without an action, of course, is futile. And implementation failures are often decision failures that show up in implementation. So this notion that we kind of blame the implementation failure and not recognize really that it could just be a decision failure that has shown up during implementation. So I've quickly highlighted to you the decision quality chain, and the authors of the text and kind of the team there. So some clients actually took the decision quality chain and turned it into a kind of manifesto for the rights of decision makers. So every decision maker can turn this around and say, I have the right to the following things if you want me to make a high quality decision. I need a decision frame that structures the decision in the most relevant context. I need to see the alternatives. That I need to have relevant and reliable information about these alternatives, an understanding of the various outcomes that are possible through these alternatives, a sound reasoning and analysis about the alternatives again, and then and they also suggest that they need a decision project leader. This is an interesting point, not about having someone who oversees the decision-making process, not from the point of view of the content, but from the point of view of the quality that the decision quality chain tries to highlight for us, really. So somebody who's trying to hold us to the highest possible standards in making sure that this decision achieves the best possible quality, having someone responsible for that, which I think is quite an interesting idea. Okay, so when we're thinking about types of decisions, look, this is not this is just a kind of one way of thinking about them. You could break them up into this notion of quick decisions, significant and strategic. Quick decisions are kind of in the moment, often cause and effect relationships are very well known. Many everyday pattern recognition is really the methodology our brain uses, the kind of system one way of thinking about things. But bear in mind, although it's fast, it's automatic, it's often intuitive, it is subject to bias. Another in the moment decision is when we're addressing emergency situations. So for example, a fire. And for those, actually without systematic training, in the moment decisions tend to be tend to be suboptimal. So for these situations, actually simulations and drills are really a very powerful, as we know from hospital care, for example, there'll be crash calls and people will do simulations and so on. Significant decisions often take hours or days, maybe weeks. Cause and effect are broadly understood. They're often very important decisions, but not necessarily very complex. So an example would be, how do we recruit? A very important question, but not necessarily kind of high on the complexity scale. I'm not saying this easy, by the way. So please don't kind of feel that I'm suggesting recruitment is easy. I'm just saying it's a significant decision as opposed to a strategic one. And significant decisions are complex, but not necessarily, they can be complex, but not necessarily especially important. So imagine you go to a conference and there's 10 workshops and they're all in parallel, and eventually you can do 3 of them. So there's a bit of a kind of combinatorial problem there of how we allocate your first, second and third choices to you, and so on. Strategic decisions take weeks or months, are important and complex. Cause and effect relationships are often not clear, often require the input of experts, and there are multiple stakeholders. And decision quality, I would suggest, is something that we would want to systematically address for significant and strategic decisions, but perhaps we would start more with the strategic end if we feel that we feel our significant ones are kind of okay for now. But certainly this end of the spectrum, really not for quick in the moment decisions. I'll just quickly show you a decision analytic tree. Some of you will see it before, just to give you a little bit of flesh on how some of this works. So imagine that imagine in the current organization, they're going through changes, and your job role is at risk. So meanwhile, you've been headhunted for a startup. So I'm suggesting this is a kind of significant or strategic decision. So now your decision is, so a square box means a decision. Do you apply for the new job? Sorry, do you go for the new startup opportunity? So if you say no, I'm going to stay and see what happens, then through a process of data gathering and so on, you kind of imagine that, okay, well, there's a 75% chance that things might turn out to be pretty good, and there's a 25% chance that things would just be okay. If they're okay, if they're just okay, then I'll definitely look for another job, and I'm not going to kind of make the best of it. I'm just going to jump ship. But if I go for the startup, then there's a kind of 35% chance I love it, or there's a 50% chance it'll be very good, or a 15% chance that it just doesn't work out, it's not for me. And if that's the case, I'll definitely look for another job. So here's an individual who would kind of draw out these options, have some way to estimate these probabilities. These are subjective. There doesn't have to be kind of, an objective measurement because they're personal. These are the values that kind of define the outcome for this individual. And what they can do is take all of these outcomes and score them on a scale, in this case, very practically from 0 to 100. 100 means it's the best possible outcome. So, go join the startup. I love it. 100 is the maximum score. And then the worst possible outcome is join the startup and it turns out to be a bit of a disaster. And so 0 would be the kind of worst case scenario. and the individual then just pragmatically scores these up, and then after a little bit of multiplication, you can see the thing here, the decision which maximizes your value is the one with the highest scores, and in this case, joining the startup looks like it's this, the option that the individual will take. Now, don't get too stuck in the numbers or the scenario, but I want to just illustrate to you really that A, there's a pragmatism to it, and B, let's say that you know, we're really uncertain about this value. We kind of think that, well, this is a little bit of a guess really, or very much a guess. So we could invest more time in working out what this probability might look like. And so what you can see, there's a kind of iterative process, but it makes things explicit and then allows you to zone in on things that kind of really really matter. So some of you will have seen these before, but I just wanted to highlight what comparing alternatives with sound reasoning kind of ends up looking like. Okay, so let me pause at that point, because that is really the most of what I wanted to say today, really. So here's the decision quality chain, and they point out really that if you want to change the culture of an organization, then changing the way people make decisions is a key lever that is kind of worth exploring. Okay, I'll pause at that point, Lucy, and if you want to go on to Menti, we can, but I'm also happy to take questions or comments, please.
Yeah, so it would be great if we could capture people's reflections on Mentimeter, if you're happy to share things on there, or we're also happy, yeah, if you want to ask a question, feel free to use the chat box or put your hand up by using the kind of participants panel, and we can have a bit of a verbal discussion if people want to come in verbally as well. So yeah, so it'd be great in terms of reflections, what you found most useful today, and also we're going to ask if there's anything you disagreed with, so be thinking about that. Should I just share my screen so people can see that coming in?
Yeah, yes, please, Lucy. And in the meantime, if people do want to kind of make any comments, it doesn't have to be a question at all. It could just be a reflection of things that you've done to enhance the quality of decision making. I'm just going to try and see the chat as well now. Sorry, I wasn't able to see it. I wasn't keeping an eye on it before.
Can't see anything in the chat so far, but things coming through on Mentimeter. Oh, I've set it up so it's scrolly. The rights for decision making, often it seems people know what they have to do, but don't feel they can advocate for it. Somebody's asked about reference for making a decision tree. Other things that have struck people are that decisions shouldn't be measured by the outcome. The idea of having someone in charge of ensuring a quality decision is made.
Somebody's had typing errors. Somebody talked about being inspiring. I think the DSU concept is inspiring. I think what you're trying to do to take really health and care to a new way of working, that's the bit that's inspiring, really. And finding tools and bringing them together and working with them, of course, that's all part of the gig, really. But you know, to have people who are willing to travel and move in that direction, I think so I'm inspired by what I'm seeing, really.
Great. I'm gonna move on just to see if there's anything people disagreed with, or so if I move the question on. Oh, hang on, have I done that?
Yes, people have talked about operations research as being one of the, so this does draw a little bit on that, and there are lots of other frameworks and methods around, really. Certainly not, you know, there is still room for more, I think, but probably one of the lessons about methods and toolkits that are out there, almost any approach that systemizes things is better than a kind of an unsystematic approach. And then after that, most methods and tools have quite a lot in common. The labels and things might change really, but yes, very happy to consider to see what other people think about stuff that has worked elsewhere as well. Oh, what was the answer to the bed question?
Yeah, there was a lot of people asking about the answer to the bed question. I think
so. It's going to be 16 plus 2 times the square root of 16. There you are. I'll leave that for you to work out. So the 2 times the square root of 16 will give you the 95% interval.
So in terms of things that people might disagree with, we've not had much, but thinking that leaders need to be engaged in this. There's too much politics and too little decision quality. I think we did have some people in the audience who are non-analysts. So I think if anyone, not to put people on the spot, but feel free to anonymously put it in our Mentimeter actually how you found it as well. I think if you would consider yourself in a leadership position, it'd be quite interesting to, yeah. So if you've got anything else that you want to add, please do let us know.
I think I once saw Peter make a presentation about how resources are used and how much resources are at the kind of at the behest of senior decision makers. And this point about decision needs, we need to decide that we want to improve decision quality. That might be the hardest thing. I think you're right. One of the things I highlighted was the illusion that we're okay. So making that addressing that I think is very important. But one way to move forward is to pick out some big significant decisions, not all of them, but maybe 1 or 2 in the first instance, and try to subject them to a different way of a different process. And so there's a kind of element of learning by doing, and the wisdom that's generated from that is really important. So kind of using QI methodology and PDSA cycles for some decisions might be a useful way to go. Yeah. So the point about culture and organization, I think, is really important. But again, if we change the way we make decisions, we will impact the culture. But these are complex ecosystems, so there's interactions all over the place, really. But finding a way to change the decision-making process will impact on the culture that the decision-making system sits in. Oh, so that point, how can accountability come in? So I think if you think of a medical example, imagine that something goes wrong in the care of a patient and there's a terrible outcome. What the kind of the test under the kind of medical legal framework is not a test of outcome. It's a test that at that point in time, did this particular clinician make reasonable decisions with the information and situation that they were faced in. So accountability isn't about outcome, I think. I think if we did make it outcome focused, then it would be very difficult for leaders. But I think if you make it process focused and say you're accountable for making sure your major decisions have 100% decision quality, I think that's doable, and I don't see any controversy, because you're not alienating anybody. Decision makers do want to make the best possible decision they can, but outcome would make it really problematic. I don't know, other people may have things that are contrary of you, really, so feel free to speak, please. Yes, it's not. I think thinking of the wrong decision and the right decision, that's probably not quite the language that would help us. I think what we probably want to think is that have we got 100% quality for the decision that we've made, recognizing that sometimes really, really high quality decisions will have a really bad outcome, and sometimes really poor quality decisions will have a really good outcome. So yes, things will go, the outcomes will not always follow because of the uncertainties, but we will have made our best attempts to try and improve the odds in our favor. and even if we can do that by a relatively small amount, there's a lot to gain, I think.
Mohammed,
Yes.
we've reached time.
Oh yes, okay, that's great. Thank you for calling time on me. I will just hand back then, thank you.
I think that was it from us, but I think Fraser's been doing some good plugging of events next week in the chat box. So we've got thinking about the role of analysts, leadership for analysts and analysts in leadership positions, particularly thinking about decision quality as well. And the fact that Al Mali's doing another session on decision quality next week. So do join that. Thank you all for coming, and the recording will be available. So please do share far and wide after the session.
Lucy and Janine, should we just